Hello and welcome back to the Painless Childbirth course. So glad to be working with you. And today is session number 5. Wow, can you believe we've done 5 weeks already of the Painless Childbirth course? And I'm sure that you've learned so much and your consciousness continues to raise as you're going through the Painless Childbirth course. That's our aim, that's our job. And of course to have the best birth possible. Well, today we have a guest. Do we have a guest with us? Remember, I asked you to bring your birthing partner and or your husband in order to join us today so that they can understand a little bit more about what it is that we're doing, and in turn they can help you have a better birth. Okay, for whatever reason, if that person is not there with you, if you don't have someone that's your partner, that's the father of the child, the baby, then that's perfectly fine. Continue to watch this video. You'll be able to learn some pointers. Whoever is helping you with the birth, you can go ahead and transfer the information onto them. So I do want to assume that somebody is there with you, and whoever's there with you, expectant dad, congratulations. And I would shake your hand through the camera. Obviously I cannot, but thank you for joining us, and it's a pleasure to have you with us today. Now, let me introduce myself in case you don't know who I am. My name again is Israel Maya, certified master hypnotherapist, and have been working with your wife or partner for the past 5 weeks in helping to raise her consciousness so that she can have a better birth. A lot of the women that have taken my course, not only are their pregnancies going better, but their birth is going much better as well. And isn't that a goal of yours, to help your wife or partner in some way in order for her to have a better birth? I'll tell you about my story later on, but as an expectant dad at one point in which I have 3 children, I was in the same position that you're in right now, perhaps not knowing what is going to happen at the birth, not being informed, obviously, first-time dad if you are, which most of the people that are going to watch this video are. So that's one thing, that's me. I do want to tell you something that's very important. I hope that whatever it is that I say in this video, you do not take any offense. Whatever it is that I'm saying, obviously, is for the betterment of your wife or partner to have a better birth. So if you ever have any questions, as I tell your wife or partner, I ask them to email me or to call me. I will answer the phone personally and speak to them. Okay, so please, again, do not take any offense as to what I'm going to say. Take whatever it is that I'm going to say as advice so that it can help your partner have a better birth. All right, let's continue. What type of category do you fit into, expectant dad? I'm going to be talking about 3 types of categories that I've seen a lot of the expectant fathers fall into, neither expectant fathers and or husbands. And by the way, I've been doing this for 10 years, and it's now the year 2010. So I started in 2000 with my wife and my third daughter, my third child rather, my daughter. So what type of category do you fit into? I've seen one of the types of categories, and please don't take offense, a very controlling, a very ridiculing type of person that just makes fun of what his wife is doing. Oh, you're doing hypnosis. That's ridiculous. That stuff doesn't work. You know, you really should have an epidural. You're trying to have a natural birth, whether it's the hospital setting or it's a natural setting, a more, maternity center type place, or even a home birth. You have to understand something, that if you ridicule your wife or if you put her down for the things that she's doing, it's only going to make her birth worse. Now, it's very important that you understand this, that the more support you give your wife or partner, the better it's going to be for her. And the reason is because it's only going to help her psychologically. Now, the better off she is psychologically, the stronger she is psychologically, the stronger she will be emotionally. The stronger she is emotionally, the better birth she's going to have. Her body's going to respond in that way. And I've been teaching her this ever since the beginning. You have to train your body and your mind so that they can work together, okay? I want you to imagine this. If for whatever reason you're the type of person that does ridicule your wife for what she is doing, for the hypnosis or for having a natural birth, imagine that tomorrow you have a job interview, okay? You've been out of work for a little while and you have a job interview, and it's a very important job interview. The potential is tremendous. You can earn a lot of money. You can even relocate to a place that you've always wanted to move to or be, or you can stay in the same place. What is it that you need the night before? You need rest, right? You need perhaps a good dinner. You need there to be peace and quiet. If you have kids, you want the kids to be taken away. You want or them to play with you and support you. You need as much support from your wife and from your family as possible. Could you imagine if the next day or the night before you didn't sleep, your wife was nagging, she was talking to you in a way that was nasty, or she gave you just problems, or the dog was barking, you didn't get enough sleep, again, you didn't have a good dinner, you had a bad breakfast, and you just went to the job interview with low spirits. You won't be able to answer the questions that your potential employer wants to hear, right? The same thing with your wife. Now, granted, the preparation is 9 months before you have your baby. You have to have a little bit more patience with her because she has hormones, and sometimes she'll have good days, sometimes she'll have bad days. You just have to be supportive as much as possible. And if you don't believe in what she does, that's perfectly fine. Nobody can change or wants to change your belief system, but just give her the support. And at least just tell her, listen, honey, if you want to do this, that's fantastic. I'll be there for you if you need me. Okay? Enough said about that one. Number 2, second type of dad, neutral dad. Now, neutral dad isn't bad. He doesn't say yes. He doesn't say no. He goes along with whatever his wife says. And you may be this type of father. Maybe you fall into this category. Again, nothing wrong with that. But if you can give a little bit more support to your wife, now I said this before about our first dad, the more support she gets, the better birth she's going to have. Period. Now, this is either in a hospital setting, in a maternity center, at home. It doesn't matter where. The more support you give your wife, the better it's going to be. Do a little research, perhaps. Get on the internet, see what your wife wants, what it is that she wants to do, and help to maybe even just validate the stuff that she wants to hear, or validate things that she's telling you, her feelings, etc. Okay, right? That women stuff. We have to give them the support possible. All right, and the third dad, you may just guess who it is. The person that supports his wife totally. And if you're this type of person, well, listen, more power to you. You're doing fantastic. Again, I will reiterate, the better she is off emotionally and psychologically, the better of a birth she's going to have. Now, why? Whatever category you fit into, why is that? Because the body and the mind work together. If they don't work together, then we can be thinking something else. We can be thinking something very negative, and our body just responds fantastic. That's not the way it works. A lot of the times when we're not feeling well, our bodies don't respond the way that it's supposed to. When we're not feeling well up here, I'm talking about psychologically, right? If you're not feeling well, if you just had a fight with someone, if something's on your mind, your basketball game is not going to be as good. You're not really going to enjoy the game that you watch on TV as well. You may not play football, tennis as well. You may not do the things that you need to do as well as you usually do them when your mind is on other things. So again, your body and your mind are connected together. They're tied in together. I understand there's a lot more preparation time before your wife or partner has the baby. Be patient, okay? Let's move on to the next section. And thank you, by the way, for listening and not taking offense. Are you ready for the big day? Like, do you know how you're going to react when she says, honey, this is it? Now, what comes to mind right now is the cartoons or the TV shows where she says, in the middle of the nighttime, she says, honey, I think this is it. I'm having contractions. I think this is the big day. And he's like, he's half asleep. He's in bed already. What? This is a big day. Oh my God. And then he runs out the door and he gets a car started. He drives off, and what does he forget? His wife, right? He leaves her behind, right? So are you going to be nervous? Do you think you're going to be nervous? Or do you think you have it all figured out, cool, composed? Let me tell you about my story real quick. It was our first baby. I said to myself, everything is going to be perfectly fine. I'm the guy. I don't have to push the baby out. I'm not having the baby, right? She's the one that's going to feel everything. All I got to do is keep her comfortable. That's it. And the day came, and I drove her to the birth center. We had decided to finally have the baby in a birth center. Again, it's our first baby, and I knew exactly what to do. And I said to her, honey, can I give you a massage, a back rub maybe? No, I'm fine. Honey, can I get you something maybe to eat or to drink? No, I'm fine. And the midwives were doing everything, right? Can I get you something? Oh, sure. Can I rub your back? Sure. Do you need anything? Sure. And it's like, what about me? What am I, chopped liver? Right? She needed the attention of the professionals in that day. And she didn't need me at that particular point in time. I thought I had it all figured out. I thought all I had to do was keep her comfortable. And it wasn't me that had to keep her comfortable. It was everyone else. So it may be nurses, it may be midwives, it may be friends. I want you to, now this is a whole class about not taking offense, right? Don't take offense if she doesn't need you in the birth. And I know that you're there listening, pregnant mom or expectant mom. You don't know how you're going to react. You may react in a way that you totally need your partner, your husband. You need him to be close to you. You need to hug him. You need to hold him. You need him to get you things. Or you may just react in a way that, no, it's okay, honey. I'm being taken care of, or I'm fine by myself. I've noticed that a lot of the women, that come and report to me after they've taken the painless childbirth class, after they've had their baby. They report to me that they wanted the support of their husbands or their partners, but they were also very much in control of themselves. So that may be a possibility. If any of that stuff happens, expectant dad, listen, bring a good book. Bring a good movie. Bring your phone. You'll be able to text or to go on the internet or something to the extent, right? But don't expect that you're going to be doing everything. And also don't expect to do absolutely nothing. Just go with the flow. That's probably the best advice I can give you as already a father of 3 and that has gone through this experience 3 times. And by the way, I was really fortunate enough to be working with someone that called me for the birth. She's a client of mine and she needed a little bit of extra support, and I was there. And on my drive now, I said to myself, it was on a Sunday, okay, and she calls me up and she says, listen, I need help. I need help with the birth. And at the time I said, for some clients I will definitely go to the birth if need be. Okay, and I've only done this twice, by the way. So it was a Sunday, about 10 o'clock in the morning, get a phone call. She says to go over there, fine, get dressed, look nice, go to the birth center, maybe be there a couple of hours tops, and everything will be perfectly fine. I can leave and come back to my project. The whole ordeal lasted about 7 hours. I was there. So on the drive there, since I already had experience with, I think at the time, 2 children, I said to myself, Israel, if she says to get out or she throws a shoe at me, be perfectly fine with that. You don't know how she's going to react. When I got there, she totally needed my support. I supported her. We did hypnosis together. In fact, she went from 2 centimeters, which is when I got there, she was at 2 centimeters dilated, to 6 centimeters dilated in 1 hour. That means that the relaxation itself helped to relax her to the point where everything opened up. Okay, so again, be supportive. All right, guys, and we don't really have it figured out in that respect. Just do whatever she wants, go with the flow, and then she'll have a great birth, and you'll have a good time too. Well, we're coming to the close of our session, and I know that this session has been a little bit more relaxed, it's been a different location, kind of smoothed a little bit, and it was really good because we all got to get together. And Dad, by the way, you're welcome to join any of the sessions. Of course, it'll all be geared toward pregnancy and birthing, but like I said, you're welcome to join us. In any case, there's something very important that I do want to talk about, and that's if you're going to have a hospital birth, please listen carefully. When you're going to have a hospital birth, there's a less support for having a natural birth. Now, many of the women that do this course, it's because you're going to have a natural birth. If you're planning on having an epidural anyway, this may or may not apply. But what is most important is, again, with support itself, that if your wife or your partner is going to have a natural birth, please make sure that the medical staff already knows that. Now, a lot of the times, what they do is they try to convince a woman to have an epidural. They may tell you, look, you're having pain, we have plenty of medication that's going to help you get out of the pain. Why should you have the pain? And the woman, the woman that's having the baby should be respected in her decision. So it really is your job to help to keep the medical staff informed and to make sure that the medical staff kind of lays off of her so that she doesn't have a difficult time in having to fight off people that are trying to give her an epidural and or give her medication. Now again, medication drugs have their time and place. They're fantastic for a lot of things. They save a lot of lives. But sometimes we just have to be respected in our decision. And the decision is, if you have made the decision not to have any drugs or an epidural, then please have medical staff respect that. All right? Just you'll be kind of the sergeant at arms of doing that. That's basically it. That's what I want to talk about. Next week we're going to be talking about different professionals that can help to tone your body and strengthen your body for the birth so that you can have a better birth, things that are way out of my scope. And that should be an interesting session. Until then, listen, have a great week. Take care of yourself. And I want to thank you again, Expectant Dad, for having joined us. And again, I will extend myself, and any questions that you may have concerning your wife and the birth and the stuff that we're doing here, you're more than welcome to ask. All right? Have a great week. Nice having met you. Bye-bye.